Hello, I'm Rosalyn Nieves. Welcome to QPTV's Health Corner. I'm with the prominent Dr. Ralph Schlossman, and we're going to be talking about a subject that's hot, the Ebola virus. Dr. Schlossman, tell us, what is the Ebola virus? Can you define it for us?
The Ebola virus is one of a group of so-called hemorrhagic viruses that were first described in Central Africa, the vector of which is most likely monkeys, and is transmitted from monkeys to humans by people who eat so-called bushmeat, who kill monkeys and eat them and so forth.
And what are the symptoms?
The symptoms of Ebola are not unique to Ebola. It could be the same kind of symptoms that one would have with the flu or other febrile illnesses. Fevers, chills, sweats, headache, abdominal pain, nausea.
So how do you know that you might have the Ebola virus or somebody's infected you if you have just flu symptoms? You would mistake it for the flu, am I right?
That's extremely unlikely because of the way Ebola is transmitted.
How is Ebola transmitted?
Ebola, differently from illnesses like the flu, is not something that you can catch from somebody sneezing or coughing. It is only contracted by direct contact with the bodily fluids of someone who is ill with Ebola. Sweat, tears, blood, vomit, stool.
Saliva, right?
Saliva, yes.
Okay. Now, other than the flu symptoms, what makes Ebola unique?
What makes Ebola unique is that the patients just get sicker and sicker. Signs of hemorrhage can appear, and the patient just goes downhill rapidly, and unfortunately, with cases so far, about 50% die. What
should we do to be proactive and, to be aware and to be safe?
At this point in time, there really aren't any community-based efforts that should be made, because the chances of an Ebola outbreak becoming either widespread or epidemic in this country are very, very slight. The places where people enter the country are already on high alert. People coming from anywhere where they may have been in Africa are being sequestered, having their temperatures taken, and if necessary, referred to health authorities.
If you were to come in contact with someone who came from West Africa and visiting here in the United States, what precautions should you take?
Well, the first thing to do is to quarantine the person who might possibly have come in contact. And it's recognized by most of the authorities that the proper time to do this would be 21 days, which is what they call the prodromal period of Ebola. And if symptoms don't develop at the end of that time, basically you have not contacted Ebola.
And just because somebody's traveling from West Africa doesn't mean that they've contracted Ebola.
No.
Because we don't want people to panic.
In fact, if someone is coming here who has the prodromal stages, that person is not infected. Okay. That person becomes infective only when the actual symptoms appear.
Okay. When the symptoms appear, how long do you have till it could be fatal?
Depends on the state of health of the individual, what their physical resistance is like, and whether they are able to obtain the supportive care that they need in a proper institution, mainly intravenous fluids.
Well, that's great information, and I thank you, Dr. Ralph Schlossman, for joining us here today.
You're very welcome. It's always a pleasure to be with you.
Thank you. If you missed any part of this segment, just go to www.qptv.org to view the entire segment. I'm Rosalyn Nieves, and I'll see you next time on Health Corner.